Hi there, and welcome to Student Midwife's Nook. Today, we will be tackling some topics under infant care and feeding, and that'll be the initial care for newborn, the vital signs. Let's dig in with some information about the temperature. Did you know that at birth, the temperature of the newborn baby is 37.2 degrees Celsius or 99 degrees Fahrenheit? Now, why is it so? Because they are confined in an internal body organ, and that is guess what? The uterus, of course. Now, the temperature falls immediately due to heat loss and immature temperature regulating mechanism. Now, the birthing room temperature can contribute or add to heat loss because the birthing room temperature is 21 degrees Celsius to 22 degrees Celsius or 68 degrees Fahrenheit to 72 degrees Fahrenheit. Now, newborn lose heat by four separate mechanisms, and that are the convection, conduction, radiation, and evaporation. Now, let's discuss the heat loss mechanism. The convection is the flow of heat from a newborn's body to a cooler surrounding air. Now, the conduction is the transfer to the body heat to a cooler solid object in contact with the baby. Now, the radiation is the transfer of body heat to a cooler solid object not in contact with the baby. And the evaporation is the conversion of a liquid to a vapor. Now, let's learn some of the preventions for this heat loss. Now, under convection, you can prevent this heat loss by eliminating air drafts from windows and air conditioners. Now, under conduction, you can prevent by covering the surface with a blanket or a dry towel. Now, in radiation, it's simply by moving the newborn as far away from the cold surface. And with the evaporation, dry the newborn as possible. Cover the hair or head with a cap after drying. Did you know that the head of the baby is a very large surface and it can be responsible for a great amount of heat loss? So, by covering the hair with a cap after drying, it further reduces the possibility of evaporation cooling. Now, the newborn can conserve heat by constricting blood vessels and moving blood away from the skin. Now, brown fat, a special tissue found in mature newborns or term newborns, apparently helps to conserve or produce body heat by increasing the metabolism. Now, the greatest amounts of brown fat are found in the interscapular region, the thorax, and the perirenal area. In addition, placing a newborn against the mother's skin and then covering the newborn also helps to transfer heat from the mother to the newborn. So this is also known as the kangaroo care, or what we also know as skin to skin. Now, when shivering or chilling is prevented, the newborn stabilizes at 37 degrees Celsius or 98 degrees Celsius within 4 hours after birth. Now, this is a common board question. You as a student midwife is a future board examinee, so you have to remember this. Well, actually, you have to remember it all by heart and by soul. But this one here is a common board question. Again, if the chilling and shivering were all prevented, the newborn stabilizes at 37 degrees Celsius or 98 degrees Fahrenheit within 4 hours after birth. All right. Now, the normal temperature ranges from 36.5 degrees Celsius to 37.2 degrees Celsius. Now, I've mentioned earlier that at birth, The temperature of the newborn is at 37.2 degrees Celsius because it was housed by an internal organ, which is the uterus. Now, while assessing the temperature, you will notice some sign of distress, and they are the hypothermia and the hyperthermia, wherein the hypothermia is less than 36.5 degrees Celsius, and the hyperthermia is being experienced when the temperature is more than 37.2 degrees Celsius. Now, let's do some practice question to better understand the heat loss mechanism. Number 1, a newborn is placed in a crib next to an open window where cool air is coming in. Which mechanism of heat loss is primarily at work here? The correct answer is convection. Now, the key word here is or are, so the newborn is placed to a crib, and then the crib is next to an open window where cool air is coming. Now, this scenario describes the flow of heat from newborn's body surface to the cooler surrounding air, which is the characteristic of convection that we already tackled earlier. You are correct. Now, let's move to the next slide. So, during a bath, a nurse observes that the baby starts to shiver shortly after being exposed to the air. What is the most likely mechanism of heat loss occurring? Now, the answer is letter D, evaporation. Now, shivering after bath when the baby is exposed to air indicates heat loss. All right, the shivering after exposing indicates heat loss. Now, the key word with evaporation is the bath. Now, why bath? Because bath involves water. So earlier, diba, we mentioned that the conversion of liquid to vapor is evaporation. So anything that has liquid in the question, ay nako, malaki ng possibility na evaporation yan. But case-to-case basis, okay, you have to understand the question first before jumping to any conclusion and answer your examination. Now, I hope you're all correct with that. And then the next slide is this. So a healthcare provider places a cold stethoscope on the chest of a newborn. Which mechanism of heat loss does this action demonstrate? Now, the answer is conduction. Did you get it right? Now, the key word here is the cold stethoscope that is placed on the surface and the skin surface of the newborn. Now, this demonstrates the conduction because the solid object came in contact with the baby, right? Okay, it's easy, right? Now, let's move to the next practice question. In the nursery, a baby is placed in a bassinet that is situated near a slightly cooler, solid wall, but not in a direct contact with it. The baby begins to lose heat. What is the name of this heat loss mechanism? All right, the answer is radiation. Okay, so the keywords is that the baby was placed in a bassinet that is situated near a slightly cooler solid wall, but not in direct contact with it. All right, so the solid object or the wall that is not in contact, okay, so let's say this is the wall, this is solid cement, so it's emitting cold or uh, cooling air by radiation. Now this is the bassinet. So the slightly cooler solid wall is radiating the coolness of the wall. right? Now you have to move away the bassinet there. Okay, so I hope you understand that. All right. So after bathing a newborn, the nurse fails to dry the baby's skin promptly. Which mechanism of heat loss is the baby experiencing due to wet skin? Now, the answer is evaporation. I hope you got it right. Now, keyword here is bathing, and bathing involves water. Now, the nurse fails to dry the baby's skin, so obviously the baby is soaking wet. Now, the conversion of water on the baby's skin into vapor leads to heat loss, and that exemplifies the evaporation. Now, let's move to the pulse. Now, pulse is being palpated by the use of a stethoscope, and it is being assessed, I'm sorry, by the use of the stethoscope, and the location would be the apical pulse. Now, during the life of the fetus inside the utero, the heart rate runs about 120 beats per minute to 160 beats per minute. And immediately after birth, it runs up to 180 beats per minute. And after an hour after birth, it settles to 120 beats per minute to 140 beats per minute. Now, when the baby is crying, it shoots up to 180 beats per minute. And when the baby is sleeping, it ranges from 90 beats per minute to 110 beats per minute. Now, the normal range of the pulse rate of the baby is 100 beats per minute to 160 beats per minute. Now, it remains slightly irregular due to immature cardiac regulatory center in the medulla oblongata. So you have to remember that, okay? Now, there are these transient murmurs or the extra harsh sounds that may result from the incomplete closure of the fetal circulation shunts. So when we say fetal circulation shunts, we are talking about the ductus arteriosus and the foramen ovale. Now, the palpable pulse is the femoral pulse. Now, the absence of the femoral pulse is a sign of COA, or what we call the coarctation of the aorta or narrowing of the aorta, and this signifies a cardiovascular abnormality. What is pulses that are very hard to palpate in a newborn is the radial pulse and the temporal pulse. Therefore, you don't have to opt to choose palpating radial and temporal to obtain the pulse of the baby. What you have to do is use a stethoscope and then assess for 1 full minute, and it should be the location of the apical pulse. So the apical pulse is located at the fourth intercostal space at the left clavicular line. Now, you have to remember that that is a common board question. This one as well, common board question. 1 full minute, apical pulse, use a stethoscope. Now, you have to warm the stethoscope first, okay? So, hindi tayo magkakaroon ng conduction. Heat loss via conduction. Now, you have to remember again that the apical pulse is located at the fourth intercostal space at the left midclavicular line. Now, there are signs of distress that you can assess in a newborn. If the heart rate or the pulse rate is less than 100 beats per minute, that is the indication of bradycardia. So, ang tatandaan nyo lang sa brady is bababa. Now, if it's more than 160 beats per minute, the condition would be called tachycardia. Now, when we say tachy, tandaan nyo tataas. Tataas, bababa. Okay? So, bababa or bumabagal. Alright? Ito naman, tumataas or tumatakbo ng mabilis. Okay? Now, you should just remember the first letter. Right? Okay. So, let's move to the respiration. The respiratory rate of a newborn in the first few minutes of life may be as high as 80 breaths per minute. Now, as respiratory activity is established and maintained, the normal range would be 30 to 60 breaths per minute. Now, there are some periodic respiration or breathing, a short periods of apnea without cyanosis. Again, a short period of apnea without cyanosis that lasts for 5 to 15 seconds. That is totally normal. All right. Now, respiratory death, respiratory rate, and respiratory rhythm are likely to be irregular. Now, respiration is observed most easily by watching the abdomen because breathing involves the use of the diaphragm and the abdominal muscles. Now, you have to know that coughing and sneezing reflexes are present at birth to clear the airway. All right. Now, here is what we can learn about short periods of crying versus long periods of crying. Now, beneficial ba talaga ang long periods of crying? Let's see. The short periods of crying is the one that is beneficial because it increases the depth of respiration and can help aerating deep portions of the lungs, while the long periods of crying has no purpose at all and it may just cause cardiovascular system exhaustion. So, contrary to the belief of the of the lolos and the lolas or the elderly in the community that long periods of crying is beneficial. No, okay? You don't have to advise that to your clients and also to the relatives of the clients. Okay? So, there are signs of distress in a newborn if the respiration is less than 30 breaths per minute, and that is what we call the bradypnea. While if it's more than 60 breaths per minute, that is called the tachypnea. And if there are apnea episodes for more than 20 seconds, now that's a sign that the newborn is in distress. Now, let's talk about the blood pressure of a newborn. So, approximately, the blood pressure of the newborn at birth is 80 over 46 millimeter mercury. Now, taking blood pressure in a newborn is not done routinely unless there is a cardiac anomaly suspected. Now, for an accurate reading, the cuff width should be no more than 2/3 of the length of the upper arm or thigh of the newborn. Now, blood pressure tends to increase with crying because the newborn, when disturbed and manipulated by such procedure as taking blood pressure, can be stimulated and he or she can start to cry. Now, at the 10th day, the blood pressure rises about 100 over 50 millimeter mercury. The thigh blood pressure may be higher than the arm or calf. Now, there are signs of distress when the oscilliometric pressure in calf is less than 6 to 9 millimeter mercury in the upper extremities, and it suggests a coarctation of aorta or narrowing of the aorta. Well, that's all for this video. I hope you remembered all the things that we discussed under the infant care and feeding, the initial care for newborn about the vital signs. Thanks for watching. I hope you subscribe for more videos and just view the other recommended videos. That's all for today. Happy learning!